So hi, my name's Michaela Nuttall and I'm a nurse up in public health, and I'm here today to tell you a little bit about diabetes. So first of all, what is diabetes? Well, it's when you've actually got too much glucose in your blood, and that can cause complications along the way. Sometimes happens because your pancreas stops producing insulin, and other times your pancreas continues to produce insulin but your body doesn't use it in the right sort of way. So who's actually at risk of developing diabetes? And we find that that group of people who are at risk are changing. We know it happens as people get a bit older. We know it happens in certain populations, so for people who may be South Asian, who are Afro-Caribbean, there's certainly more groups of people who are at higher risk. But we know that people who are overweight or with a big waist circumference, again, that puts them at a much greater risk. And then we have people who have diabetes through pregnancy or polycystic ovaries. They too are at greater risk of developing diabetes. So what are the symptoms? Well, some people get the symptoms and some people don't. And so the main symptoms will be feeling a lot more thirsty and feeling the need therefore to keep drinking, getting up a lot in the night to go to the toilet to pass urine, having a feeling of tiredness and fatigue that just seems to be unwarranted, and also maybe sometimes accompanied by weight loss. And because of the increased blood sugars that are there, it sometimes can result in a lot of thrush. So how is it diagnosed? Well, you end up with usually either in GP practice or sometimes it's picked up in a hospital, and it's done simply by finding a little dipstick into your urine and seeing if there's any glucose present. If there is, then it's moving on to the next step, which is a blood test, to be able to look for the presence of glucose there in your blood. And if it's found there, then there's another test where they sort of test your tolerance to glucose. But again, that's again like a blood test. It's not that painful. What can be done to reduce your chances of developing diabetes? Well, with the first set of diabetes, type 1, which often happens when people are children or teenagers, there's not a lot we can do to prevent that one from happening. That's where your pancreas simply just stops working. So the one that you can prevent is the type 2 diabetes, and this is the one that we're seeing more and more of, not just here in Bromley, but actually across the country. And this is happening because people are living sadly unhealthier lives, so that being overweight and not taking enough physical activity. So therefore, taking enough physical activity, eating a sensible diet and maintaining a healthy weight are key to preventing diabetes. But also taking those three things into account as well are also key in reducing complications once you've developed diabetes. The complications that can happen can start in from the top. It can affect your eyes, and that's why people they go for retinal screening usually every year, all the way down to your toes, because people have problems with circulation and therefore healing can take a bit longer, and people's get foot ulcers, and it can become quite a lot of complications with diabetes. So the best way is to look after yourself and try to prevent those. And one of the most important things you can do to manage diabetes is look after your blood pressure. And that again is either doing it through a healthy lifestyle or sometimes having to take tablets for it. The next most important thing is looking after your cholesterol and also your blood sugar. So if you think you've got any of the symptoms that I mentioned a little bit earlier, what should you do about it? Well, some of those symptoms can happen anyway. A lot of us just feel tired some of the time for other reasons. But if you find some of those symptoms, you've got quite a few of them, then it may well be worth popping along to your GP and running the symptoms past him or her, and let him be able to think about, or her, think about doing the dipstick in your urine.